Good. Okay, so this is my assessment of the cranial nerves. This is my patient. I'm going to assess all 12 of his cranial nerves. First, we're going to start with cranial nerve 1, which is the olfactory nerve, so that assesses smell. So I'm going to have you smell this, please. Can you tell me what that is?
Cinnamon.
Okay, so cranial nerve 1 is good. Cranial nerve 2 is the optic nerve, so I would need an ophthalmoscope to actually look at the optic nerve, but I don't have one, so I'm just going to pretend. So you come down at a 15-degree angle and look into the patient's eye and check the optic nerve and optic disc. Cranial nerves 2 and 3 have to do with pupillary reactions. So I would assess with my pen light the pupillary reaction of his eyes. So if you just look straight ahead, I'm going to just shine a light in your eye. Good. Okay, good. Okay. So his pupils are equal, round, and reactive to light and accommodation. Cranial nerves 3, 4, and 6 all have to do with the movement of the eye. So cranial nerve 3 is the oculomotor nerve. Cranial nerve 4 is the trochlear, and cranial nerve 6 is the abducens nerve. So I'm just going to have him follow the movements of my pen light. Okay, good. So we're done with the eyes. Cranial nerve 5 is the trigeminal, so I'm going to just have him clench his jaw. I'm going to feel the muscles. Good. Now move your jaw from side to side. Good. And then the sensory part of that nerve is his sensation on his face. So I'm just going to use a broken Q-tip. You're going to close your eyes and just tell me if you're feeling something soft or sharp.
Soft. Sharp. Sharp. Soft.
Okay, good. So now we're going to move on to cranial nerve 7, which is facial. I'm going to have him, just going to assess the symmetry of his facial muscles. So I'm going to have him smile, frown, puff out your cheeks. Good. Okay, so cranial nerve 7 is intact. That is his facial. Cranial nerve 8 is the acoustic nerve, so it's hearing. If I had a tuning fork, I could do different tests like the Weber's test or to test for air and bone conduction, but I don't. So I'm just going to occlude one ear and whisper, and he's going to tell me what word I whispered.
Balloon. Cupcake.
Good. With the tuning fork, what you could do is, I'll use this as an example, you would strike the tuning fork and then place it on his forehead and see when he stops hearing. He should be able to hear it. And then the other one for bone and air conduction, you would strike it and place it on the mastoid bone, and when he stops hearing it on the mastoid bone, you would move it in front of the ear and he should still be able to hear it, because air conduction should be greater than bone conduction. So that's it for hearing. You can also rub your fingers next to their ears and see if they're able to hear that. Cranial nerve 9 is the glossopharyngeal nerve, and cranial nerve 10 is the vagus nerve, so they both have to do with swallowing, and the glossopharyngeal is for soft palate movements, and the uvula. So I would ask the patient to swallow. Okay, and I'm going to use my pen light and just open, say ah. Good, so I can see that his soft palate is moving, his uvula is midline, and he didn't have any trouble swallowing. So cranial nerve 11 is the spinal accessory nerve. So I'm gonna then ask him, shrug your shoulders. Good, and I'm just gonna have you turn your head against my hand. So turn all the way to your shoulder, good. And then again, good. So I should feel some resistance there. And cranial nerve 12 is the hypoglossal, so it's the last of the cranial nerves. And the way that you check that is you have the patient stick out their tongue. So stick your tongue out straight. Good. And so you're looking to make sure that you can put it back in your mouth. You're done. So you're looking to check to see if the tongue deviates to one side or the other. If the tongue does deviate to the one side or another, it would indicate to you where the hemiparesis is in the brain. So there's like a little saying, lick your wounds. So if the tongue is deviating to the left side, then they could have a damage to the left side of the brain or a hemiparesis. And that is going to conclude my assessment of cranial nerves.